In this video, you'll be learning about the red points listed below. Please take into note that this video does go fairly quickly, so feel free to pause whenever you like. What is a myocardial infarction? The more common name is a heart attack. It is a necrosis of heart muscle due to inefficient supply of oxygen. A heart attack occurs every 20 seconds and a heart attack fatality occurs almost every minute. Causes of myocardial infarction. This occurs when flow of blood becomes blocked, or it results from an imbalance in oxygen supply and demand, most often caused by plaque rupture with thrombus formation. Probably the biggest myocardial infarction I get asked is, what can cause a heart attack? Well, there are several factors, and these can be shown in the pictures below. Bad cholesterol is a common cause of heart attacks. It is found in food eaten, and our body makes it naturally. Not all cholesterol is bad, but LDL can stick to walls of arteries and produce plaque. Saturated fats may contribute to buildup of plaque as well. It is found in meat and dairy products and may increase bad cholesterol. Then we have trans fat, which are artificially produced and increases risk. Signs and symptoms. How will I know if I am getting a heart attack? Well, we can take a look at vital signs. It shows increased heart rate, irregular pulse, blood pressure being elevated, increased respiratory rate, coughing, wheezing, or production of sputum, as well as hypotension and carcinogenic shock can be seen due to right ventricular or severe left ventricular dysfunction. Diagnosis. 3 ways of diagnosing heart attacks includes 1. Laboratory tests, 2. Electrocardiography, and 3. Cardiac imaging. In laboratory tests, we are able to identify cardiac biomarkers, troponin levels, complete blood cell count, comprehensive metabolic panel, and the lipid profile. Electrocardiography is the most important tool in initial evaluation. Confirmatory of diagnosis in approximately 80% of cases is made. Cardiac imaging is another important technique in which coronary angiography can be used to definitively diagnose or rule out coronary artery disease. Risks. Risk factors include high blood pressure. High blood pressure damages the arteries and accelerates the buildup of plaque. Then there's high triglyceride levels. Triglycerides are a type of fat that clogs up arteries. Then there's high cholesterol levels, which can change with medications. All 3 of these increase the risk of myocardial infarction, as those increase as well. High blood sugar levels can damage blood vessels and eventually lead to coronary artery disease and/or heart attacks. If you're overweight, it increases the risk of having a heart attack, as it is associated with various other conditions as listed below. Smoking tobacco also increases the risk of myocardial infarction, and it may also lead to other vascular conditions. Next, we have age, where the risk of having a heart attack increases with age. Then we have family history. If you have a family history of heart disease, then you're more likely to get a heart attack. Then we have other factors, which include stress, lack of exercise, use of illegal drugs, high blood pressure during pregnancy, or history of. Treatment. Most heart attacks require immediate treatment, in which most begin in the emergency room. There are different methods to treat heart attacks. Angioplasty is a surgical procedure used to unblock arteries that supply blood to the heart. Coronary artery bypass graft, otherwise known as CABG, reroutes veins and arteries. Then we have medications, where different medications perform different functions. Angioplasty is a method where a catheter is put through the artery to reach the blockage. It inflates a small balloon attached to the catheter to reopen the artery, allowing blood flow to resume. A surgeon may also place a stent at the site of blockage to prevent the artery from closing again. CABG is a method where the surgeon reroutes the veins and arteries so blood can flow around the blockage. This is sometimes done immediately after a heart attack, or it's done several days after to leave time for healing. Blood thinners, thrombolytics, and antiplatelet drugs are all used to prevent new clots from forming and existing clots from growing. Then we have nitroglycerin, which is used to widen blood vessels. And then we have beta blockers and ACE inhibitors, which both lower blood pressure and helps relax and decrease stress on the heart. So in this video, you learned what a myocardial infarction is, causes, signs and symptoms, diagnosis process, risks, and treatment. Head to part 2 to look at the aftercare, prevention, and be quizzed a little bit. Thank you for watching.
Created using Powtoon.